Farmlink is a project that addresses suicide in the farming population of northwest New South Wales. So our aim is to improve the mental health and wellbeing of people who live and work on farms. Farmlink is funded under the National Suicide Prevention Strategy, and that funding is administered through the University of Newcastle, specifically the Centre for Rural and Remote Mental Health. We recognised as part of what we were doing with Farmlink that there was a need for a new education and training. So the SCARF program is a 4-hour community training and a 3-hour clinical training. SCARF stands for Suspect, Connect, Ask, Refer, Follow Up. The whole first half of the program focuses on health and wellbeing. Then we talk about suicide in rural areas specifically. We introduce a theory of why people die by suicide. And then the latter half of the program is the action plan, SCARF, and how to apply that to help somebody who may be in need of mental health care. Our primary target audience are farmers, people living and working on farms, and farming families. Our secondary target group is frontline agricultural workers, people who work closely with farmers, agribusiness bankers, vets, livestock agents, people working in natural resource management, agronomists. So our rationale is that if we educate one of those frontline workers, we're indirectly reaching many of their farming clients who they already have a good relationship with, and they're well placed to recognise when there's a problem and to get farmers to help. Our tertiary target group is health professionals. There's some evidence to suggest that people who die by suicide have seen a general practitioner within 3 months prior to taking their own life.
When the government identified suicide prevention as a major issue, and particularly people at high risk would be those who are in agriculture. So the strength of the University of Newcastle is that it can provide the research evidence, it can provide the methodology that will design the studies that will show good value and effectiveness of the programs that are delivered. So at the end of the program they can say, I understand my physical and mental health better, I understand the risks of suicide, I know how to identify someone who is at risk of suicide, and I'm confident that I can speak to them about seeking help if they are at risk of suicide. And that's what we've been able to demonstrate. That's what the program does.
Since its inception, Farmlink has utilised the LIFE framework to inform its work. We've disseminated the LIFE framework to people that we work with in the community. We let them know that there is such a thing. We direct people to the fact sheets, which are very useful and contain some really informative advice and guidance on some of these issues. And we also reference the LIFE framework in our SCARF education.
In the future, it's so important that we're able to fund public health programs in prevention. So much of medical research goes into treatment and services for people who already have an illness. Very little, proportionately, goes to prevention. We really have to look at opportunities that we can enhance lay people's knowledge about suicide and prevention and empower them to be able to assist others. We really don't need to do this with health professionals alone. It's everybody's business to be able to assist others in distress.